Hey guys, this is Dr. Laura Ritchie. I'm a certified women's health and functional nutrition coach and doctor of physical therapy. And thank you guys so much for joining us tonight. This is our pregnancy, birth, and babies class with essential oils. And for those of you that are new to me, welcome, or if you're catching the replay, welcome to the replay. This is so much fun. We get together and we do virtual classes and we just share about essential oils, which are something that has been such a gift to me in my own life and my own healing journey. And I'm excited to share with you guys. There have been a lot of people asking questions about this and wanting to learn more about essential oils for birth and babies and what to do, and that can be an area that can be a little confusing. So we're here to shine some light on that and give some support with that as well. So I want you guys to, if you're available, type in, let me know where you're from. Let me know if you're hearing me okay. I would love to know what you guys are up to on this Monday night, and we will get started. There are handouts that go along with this. And please just note that you're not going to be able to download the handouts from an iPad or a smartphone or anything like that. It's got to be from a computer or a laptop. So just a little heads up there. I've been getting some questions about that, but you can get your handout and follow along with us. And one of the things that I just want to preface this class with is that I am not a mom. I do not have personal experience in this area with pregnancy, birth, and babies. I am a licensed physical therapist. I specialize in women's health and pelvic floor dysfunction. So I saw a lot of patients in the clinic with pregnancy that were dealing with different things. And that's one of my specialties in treating patients, but I don't have my own experience with being a mom or any of that. I actually went through some health challenges about 5 years ago where I had a very rare sarcoma called a desmoid tumor that was in my abdominal wall, and that was removed. I had 4 surgeries related to that, and part of that journey was being told for medical reasons that I should not have a child, that my abdomen wouldn't physically hold, or that the tumor has estrogen receptors and it could cause a recurrence. So that is something that we are just being aware of, and I just wanted to preface that. But I do have some resources that are going to be really helpful for everything too, and be able to answer your questions, but I just want to kind of throw that out there. Also, if you're not a mom, the information in this class is still going to be really useful. It's still going to be important. We're going to be talking about things to help with sleep, things to help with pain. All of us can use those things in our daily lives, but we're also going to preface it for this population too, which will be really nice. And that's actually what brought me to essential oils, was all of my different health challenges, from the cancer that we talked about, to being diagnosed with adult hip dysplasia, to being diagnosed with Lyme disease about 1.5 years ago. All of these things really got me looking for natural alternatives and natural ways to support my health and healing along this journey, and what inspired me to take a 1-year certification in women's health and functional nutrition coaching and just diving deeper. I'm actually taking a 2-year nutritional endocrinology practitioner training right now to just learn more and more about all of this. So if you're finding this information helpful, please, there's hearts. You can click on the hearts or the thumbs up, and it just lets me know that this is helpful information that we're seeing. And let's get started with everything. So we are going to talk about natural support for a healthy pregnancy and things that we can do during this time. And why is this so important? Well, no matter what your birth plan is, essential oils can give you a little bit of support and comfort in a lot of different areas with this, from the pregnancy to delivery to bonding with your newborn baby. All of this is really, really important, and we can use the oils with this. So I want to preface this too, that I am a doTERRA International Wellness Advocate and Educator, and all of the information in this class that we're going to be talking about is really specified for doTERRA essential oils, because especially when we're talking about using oils during pregnancy or with babies, we really want these oils to be pure, therapeutic, high quality oils, and doTERRAs are tested by independent testers throughout this whole process to make sure that these are the safest, purest, in my opinion, oils to use. So I just want to preface with that, and that's really important because we don't want chemicals, fillers, things in our oils, and there's no governing agency that regulates that, and that's why doTERRA has kind of set their own standard that they are certified pure therapeutic grade. So just FYI with that. I also wanted to start that if you have this book, this is the Essential Life book, and this is something that I gift to new oilers on my team. There is a whole section on page, let's see here, 242. And it is all about pregnancy, birth, and babies, lots of great stuff. So we're just going to be skimming the surface in this class, but there's a lot of other resources too out there for you to have as well. And I also really like the Modern Essentials book. This is another great book to have on your bookshelf to have reference. And one of the nice things is they have a quick user guide chart in the back here. And this is so handy, guys. And you can quickly look at this chart and there's whole lines for pregnancy and which ones for internal, aromatic, and topical use. So you can use that as a really quick reference too with everything. And I really think that having books and resources are really important. This is going to be an intro class, but you can really dive deeper with this. Another book that I highly, highly recommend is Essential Oils for Pregnancy, Birth, and Babies. And this is by Stephanie Fritz. And you can get this on Amazon. It's very inexpensive. It's a really great read and it has lots of valuable information in there too. So something to check out and have on your bookshelf as we dive deep into this. There's a couple of oils that are really great and work really well for pregnancy. And we will go through some of those right now. One is bergamot. This is one of my favorite oils in general. I really like this oil. Emotionally, it helps with self-acceptance, but you can use this to support you during your pregnancy to ease any leg spasms or aches that you may have. You can diffuse it in a diffuser. It has a really uplifting aroma to smell and just supports your emotional well-being while pregnant. And it's just a nice oil to have on hand with that. Ginger is another really nice oil to have on hand. And ginger is really, really great to ease any nausea or aches. This can help to improve your appetite because, oh my gosh, how many pregnant women are struggling, especially that first trimester, with the morning sickness to just keep stuff down. So they can add some ginger in there. This can also help to support your immune system. It can be a really nice boost with everything. Lavender is another really nice oil. Oh my gosh, guys, we just love our lavender. It's so, so nice. It's so, so helpful. So this can calm anxious feelings, can calm any tension. This can help support your sleep because sleep could be an issue when you're pregnant and really helps to smooth any skin irritation or itching. You could just apply that on as needed, any breast tenderness or muscle aches, and really support any seasonal respiratory health. And we're in that season right now where we may need a little bit of support and respiratory health with everything. So lavender would be a great one to use. Wild orange is another really great oil to use. And this can help with easing feelings of anxiousness, anger, nausea, sleeplessness, fatigue. Can also help to support your digestion. So all of those can be really important during pregnancy. And then ylang ylang. I really like this oil. This is the oil of the inner child emotionally. So this can help to ease any sadness and frustration. It can support healthy circulation and can even help with peaceful sleep, believe it or not. So you may try one and see how you do with that. And there's an oil that can support you. doTERRA is like a buffet. So you may try one, you may try lavender and see if that helps with your sleep. And if not, maybe try wild orange, maybe try ylang ylang, maybe try a combination of those. Everybody's different. I believe in that bio-individuality. I believe that we all have a different microbiome. So what works for one may not work for you. And you can look and try for finding the right oil that works for you during your pregnancy with everything. Oils that you may want to avoid. And you know, this is a little bit controversial. Stephanie Fritz talks about in her book, and she uses doTERRA essential oils, and she talks about how really she says with doTERRA oils that they're really safe and pure and therapeutic grade, that she feels safe giving them to her clients, using them, and she's never had any adverse reactions. If it was a little intense, they just added more carrier oil. So I say take this with a grain of salt. I also believe that you have to trust your intuition. You have to trust your gut. You have to trust that mother's instinct with this too. But what's recommended to avoid per this handout is arbor vitae, birch, cassia, cinnamon bark, fennel, myrrh, oregano, and wintergreen. And these are really hot oils. These are warmer oils. So again, if You could really dilute them, heavily dilute with your carrier oil, or you could just leave those out for right now and see. Okay, so it looks like Linda commented for us. I only wish I had these amazing oils during my pregnancies. Oh my gosh, I know, Linda. Anyone who's pregnant and planning a family needs to get these and be prepared for everything. We have them all now, so I agree. Yes, try many and find out what you like. Oh, thank you so much, Linda. Thanks for that comment. That's really, really helpful. Absolutely. Great, great advice. So how are we going to use these oils? How are we going to use these gifts of the earth? And doTERRA actually means gifts of the earth, guys. So you can deeply inhale them. So you could apply an oil. We're going to use wild orange for now. And you can either drop it, they can come out a little fast, or if you're a new oiler, you can just put your hand over the cap, flip it, and that'll give you plenty of oil to put on your hand. And you can just add a drop, and you can put it in your palms. With pregnancy, you'll want to dilute. So about 1 to 2 drops of an oil to a teaspoon of a carrier oil. So something like fractionated coconut oil would be great. doTERRA has their own. I personally really like the In Vivo fractionated coconut oil. You can get this on Amazon. I like it because it comes in a pump bottle. It just works really nicely as well. So you can add a little bit of your carrier oil to that. And you can rub your hands together, cup it over your nose, and inhale. Oh, it smells really good. You can even put it on the back of your neck, on your shoulders, anywhere there. That's the only bummer with virtual classes, guys. We don't have smell vision. You can't smell what I'm smelling. But if you have your oils at home, get them out and play with them and use them with me. And yeah, you could apply oils wherever you need them. You can diffuse them. So this is going to be really helpful for immune support, emotional support, respiratory support. And you could put 3 to 5 drops in your diffuser and diffuse it that way. Now, when you're using your water-based diffusers, the essential oils are heavily diluted, so they're safe to use and purify and cleanse the air in your home. You can make a mist. So you could get a little spray bottle, a little glass spritz bottle. They have those at the health food store or on Amazon. And you could add some oils to the water and just mist and spray it in the air. You could spritz some lavender over your pillow before you go to bed. You could put some wild orange and spritz that in the air for emotional support when you need to. That works really well. You can use the oils on your skin. So you can apply the diluted oils to the bottom of your feet. That's a great place. We have large pores there that help with getting good absorption, and that works really well. Or just to the area of concern. Say you're having knee discomfort. You could put the oil right on your knee to support you. Low back discomfort. You could put the oil there, and it works really, really nicely. You could do a bath. So this would be a really nice thing to soothe and relax yourself. You could put a drop of an oil into warm bath water. And remember that essential oils are heavily concentrated, guys. These are 50 to 70 times more concentrated than herbs. So a little goes a long way. And that's an amazing thing because with a bottle this size, a 15 ml bottle, there's about 250 drops in here. This is gonna last you a really, really, really long time, which is nice to have on hand. And then massage. So massage can be really soothing, relaxing. This can be a great thing for you to do during your pregnancy. And you can add a drop of essential oil with the carrier oil or some kind of lotion. doTERRA has lotions that are made to be used with your essential oils. And you could have somebody give you a light massage. And that could be a really nice thing to do as well with this. But you just want to remember that 1 to 2 drops per teaspoon is going to be enough, and having that diluted during pregnancy. And just having a little bit of extra carrier oil on hand with that. So let's talk about support during your pregnancy. And we want to dilute with all of these things. But say you're having anxiousness, you could inhale wild orange or lavender. You could put that in your diffuser. You could add lavender, ylang ylang, and geranium to a warm bath. So geranium's another oil. This has a really nice flowery scent to it. It's a nice oil to kind of have on hand. But you could add this to the bath with your lavender and ylang ylang. You could do a couple oils for bowel support. So lemon and ginger could be really, really great oils for that. And you could just apply it to the stomach. So just a drop or 2 of each, use your fractionated coconut oil and just apply that to your stomach as needed to help with bowel support. If you're having breast tenderness, you could put a drop of lavender on the top of each breast. Again, dilute with that fractionated coconut oil and rub that in. For circulatory support, you could do lavender or ylang ylang to a nightly bath or in your diffuser. So lots of different ways to use these. Fatigue, wild orange. Oh gosh, guys, I use this so much during the day. It's great to diffuse in the workplace or at home or just have on hand. Works really, really nicely. Any of the citrus oils are really uplifting and supportive in that way. For a growing belly, there's a belly butter recipe, and we'll talk about that coming up too. That can help. For itchy skin, lavender's my go-to. Lavender's so supportive of skin issues and can be really helpful. For muscle aches, you can apply lavender, bergamot, or sandalwood. All of those are really nice oils to have. I don't think I've showed you guys sandalwood yet. It's a nice oil to have on hand. You can do a lot with it, with our sandalwood here. And so that would be great to use for any kind of muscle aches that you may have. For nausea, you could make a mist in a spray bottle. You could do 10 drops of peppermint or ginger, 5 drops of wild orange, 5 drops of our lemon, and then just add that to a 2-ounce bottle and top with water. And you could even start with less than that, guys. This is really an individualized thing. So less is more with oils. You could start with maybe 1 or 2 drops of those and work your way up. We can always make it stronger if we need to, but you could just mist that into the air and inhale. You know, keep that around, especially the first trimester when you wake up in the morning and like you're just feeling yucky. Have that spritz and have those oils to support you. You can also, this is really interesting, take our ginger again, and you can massage some ginger into the earlobes to help with nausea. So again, you're going to dilute. We never want to put essential oils into our ears, but we can put them on the earlobe or around the ear would be okay. So that could be another one. We have reflexology points, and you can add and apply to those as needed to support you. For respiratory support, lemon under the nose could be a really great place to do that. You could put it on your chest. You could put it on the bottom of your feet. For sadness, lavender, frankincense, bergamot, wild orange, geranium, all of those can be really helpful. You could diffuse them in the air for that emotional support or apply to the bottom of your feet as needed and diluted. For sleep support, lavender. Lavender is usually our go-to for sleep. A lot of us love lavender. Lavender's that gateway oil, but you could try ylang ylang. And before bed, you could diffuse those, get those going in your bedroom to help support sleep, or do a bath with those. And that could be a really nice soothing thing before bed to just support you. For tension in the head and neck, and this is where I love essential oils, guys, and essential oils shine, because when you're pregnant, you can't take a lot of medications, right? And you don't feel good, and that's frustrating. Oh man, I mean, come on. So let's have some natural remedies to support you with that. So you could put lavender on the back of your neck, on your temples, and have that for head or neck tension, which is really, really great. And for urinary support, you could do lemongrass over the bladder. And this is a really great oil. And actually, guys, there's a BOGO special going on. doTERRA has buy one, get one free. And it just started today, Monday. And they're doing one special every day this week. And the BOGO today is actually the 2 oils that we're talking about right now. So if you purchase Cypress just today, you can get lemongrass for free. So that's pretty amazing. I'll talk about those too at the end of class. But Cypress over the kidneys can be really great for urinary support. And we've got lemongrass that can be right over the bladder area. So the kidneys are kind of that back lower flank area, and that's where you would apply your Cypress. But it's kind of neat that those came up in this class to support you and that there's a BOGO with both of them right now. So get your urinary support. This is an amazing deal. And this is really interesting, guys. There was an 8-year UK study. So shout out to all the people from the UK watching and staying up really late. We love you. Thank you for joining in. But there was a UK study that found that the use of essential oils in the maternity ward actually helped to relieve anxiousness, aches, discomfort, and nausea during labor and delivery. Wow, that is amazing, guys. And the soothing and calming oils, including lavender, really helped women who were having a more comfortable birthing experience. How amazing is that? And that's Burns et al. 2000. Really great. I mean, labor and birth and delivery, I don't know, guys. I've had 2 fractured pelvises, and that was plenty for me. I can't even imagine going through all of that. But I do see what my clients talk about and what they kind of mention and what the body goes through. And birth is really an amazing thing, guys. Like, wow, your body is a miracle. It goes through so much, and that's a trauma. That's a serious thing happening to your body. So being able to support yourself in these ways is so, so important. So let's actually talk more about support during delivery. So you want to take your oils with you, pack them up, take a diffuser with you, put it in your hospital bag, take everything with you, and instruct somebody ahead of time on how to use the oils. Make sure your husband knows how to use the oils. If you're having a midwife or a family member, anybody who's supporting you, we want to get them on board and be able to use the oils, maybe even make little notes or labels for them, have that on hand so that they know and they can help you with your care and those techniques and implementing these oils with everything. So there's a nice little recipe on your handout for a calm mama mist, and it has lavender, wild orange, and peppermint. And again, this could be great. You can put it in a spray bottle and just put some distilled water, and you can just periodically spray the mist, and you can have that going to support you emotionally with everything. For somebody going through back labor, doing 1 to 3 drops of diluted black pepper to the lower back can really help, and you can also apply a counter pressure to that if that's comfortable. So all of these things that can really help support you in those different areas are really, really important. And now let's talk about soothing postpartum discomfort. So if you're having any anxiousness afterwards, wild orange, guys, you can do a lot with wild orange and lavender. Wild orange or lavender in a diffuser can really help everybody in the family, right? Like you just had a baby and you need to rest, and here comes everybody into your room. So you can diffuse that for a little bit of support. Roman chamomile and frankincense is also really helpful in this area. And I'm so excited, guys. Roman chamomile has been out of stock for the past year and a half, maybe 2 years. It's been a while. The crop was damaged and it didn't pass doTERRA's rigorous testing and inspection, so they're not going to put an oil out there that doesn't pass that, which is really amazing. Another reason why I really trust doTERRA. And Roman chamomile comes back in stock December 1st. So mark your calendars, you can get it. I'm so excited. I think it's limit 2 per household, and I'll probably have to get 2 because I've gone so long without it. I'm so excited. So get your Roman chamomile, and this can be really helpful. If you're cramping after postpartum, you can massage a little bit of diluted lavender or clary sage. Clary sage is another really nice one onto the lower abdomen. And this can be really, really helpful. You can also do a hot compress or a heating pad, maybe a warm water bottle on there. And you want to make sure that you're getting plenty of rest. Your body just went through a marathon. It's time to rest. It's time to take care of yourself. For any kind of wound care, lavender works really, really great, guys. Frankincense, another amazing oil. There's a reason why they call it the king oil, the baby Jesus oil. It's amazing. It's so, so supportive, and it's an enhancer oil. So you can layer your oils. You can put on one oil and layer with frankincense. It works really well. Helichrysum is an amazing oil. It's one of the pricier oils, but it is worth it. I think it's one that we all need to have in our bag of tricks because it's known as liquid stitches, and it actually stops bleeding on contact. It's one of those amazing things. You can put it right on the bridge of your nose if you're having a nosebleed to stop that. It works really, really well. So that's a nice one to have on concern. And if infection is a concern, you could also do melaleuca, and that could be a great one, or tea tree oil could be a really nice one to use as well. So let's talk about peritoneum care. This is really important, guys. So this is where my pelvic floor physical therapy hat is going to come out for you guys. This is Bertha. This is our pelvic floor model here. And the peritoneum is really this area from the anus here in the back all the way to the vulva in the front. This whole area is your peritoneum. And when you're having a baby, this can often be torn with either an episiotomy where they cut this area to allow room, or where you just have a tear in this area, and that can be really painful. We have different degrees of tears. Some women unfortunately have a full tear all the way from the vulva and the vaginal canal internally all the way to the anal opening, and that is really unpleasant. That is really not fun. What I would recommend, if you have a midwife or somebody supporting you, unfortunately there's not a lot of OB-GYNs that are still doing this, but you can do a peritoneal massage. You can Google how to do this, but if you've got somebody that's patient and willing to work with you during labor, they can actually work and stretch this tissue out and allow that to work much, much better during delivery, so that decreases the likelihood of a tear. And I just wanted to preface that because I think research was showing that when people do an episiotomy, that almost became a standard practice, but it became like the body would follow the path of least resistance. Like if there's a cut in the paper, it's just going to go even further. So really maybe talk to your OB-GYN about doing peritoneal massage or getting somebody in there, or teaching your husband how to do this, something that can really help. Because guys, there's so many muscles, nerves, fascia, a lot of stuff here that doesn't get a lot of cred. And so I just wanted to preface with that. This is really, really important. Another thing that I really want to talk about is it's important after you have a baby to see a pelvic floor physical therapist, because all of these muscles that make up the pelvic floor, this bowl, this is what's supporting and holding up your organs. Your uterus, your bladder, your colon, all of this. And a lot of women may have urinary leakage or issues after they have a baby. In Europe, it's just standard of care that they see a pelvic floor physical therapist immediately after. And it's not the case here. So search out people. There's 2 websites. One is Herman and Wallace, and one is the American Physical Therapy Association Chapter of Women's Health. And I'll post links so you guys can find a pelvic floor PT in your area, because this is very different than regular PT. But I just wanted to preface with that, because this is really, really important. And we want to be taking all of this into consideration with your health, because my patients, guys, would come to me and they would be told, well, urinary incontinence or fecal incontinence or stuff, that's just part of old age, or you just need to get a bladder lift or different things. And these are muscles, just like muscles anywhere else in the body. And we can do a lot to strengthen and support these. So I will get off my soapbox here, but I just wanted to preface that it's really, really important to take care of yourself and have all of this checked out by a skilled and trained pelvic floor physical therapist for that. So that's the peritoneum. We're going to talk about peritoneal care, but you really want to work on supporting yourself as much as possible, and adding a few drops of geranium or lavender or helichrysum to a small misting bottle could be really nice. And you could just gently mist that area if it's really tender. You know, oh gosh, it's probably going to be really tender to sit for a while. Probably that first bowel movement afterwards is going to be right? A doozy. So supporting yourself as much as possible with this. You can make a soothing pad. You could put a couple drops of lavender or something like Roman chamomile or geranium into a bottle of witch hazel, and you could just kind of shake it up, and you could put that on a maxi pad. You could put them in the freezer, and then you could just have very cooling to use to help with that. Sometimes ice applied, not directly, but to that area can be very helpful too. Because it's swollen, it's bruised, it just went through a lot. So it's really important to take care of yourself. With postpartum sadness, you could use a combination of lavender or patchouli or frankincense or clary sage and put that in the diffuser or in a bath, or put it with a carrier oil to do a massage. Or you could put on the bottom of your feet a couple times a day. And this is really important. Also making sure that you have enough omega-3 fatty acids. That's very, very important too with postpartum health. And this is a common thing, guys, that we really need to be looking for and be aware of, and have support needed where we can use that to help us in those times. So with breastfeeding, with nipple care, you can use lavender and use that diluted to the nipples after each feeding. You can do that to really just help with any soreness or tenderness there. If there's fussiness going on, you could diffuse lavender or wild orange, and that can just help to calm you and calm your new baby. If there's discomfort and you don't want to stop nursing or pumping, you could use lavender on top of each breast throughout the day. Again, that could be really helpful. You could massage a blend over your breasts of melaleuca and lavender and Roman chamomile in those 2 tablespoons of your carrier oil. And you want to massage from the armpits towards the nipple, moving in this direction. So again, we always want to move distal to proximally in the area towards the heart. And that can be a nice thing to do. Milk supply issues. You could do 1 to 2 drops of each. And it just depends on what you need. So we're going to make this kind of for specific things. So with starting production, you could use your clary sage. Now, something to just point out when you're really working on starting production of milk supply is avoiding peppermint, because for some women, and again, this is all individualized, for some women, peppermint may actually reduce the milk supply. So just something to think about and just to kind of have on hand with that. If you're trying to increase your milk supply, basil or fennel, and you don't want to use fennel for more than 10 days at a time, but you could use those. You could drink plenty of water, rest as much as possible, and you really want to work on eating a nourishing diet. And sometimes women who are going through pregnancy, they have C-sections, so then you have major surgery on top of everything else. So this is really a time to take care of yourself as much as possible. Create a web of support, have things set up ahead of time where maybe family members or friends or different people can come in to help you with this. If you're decreasing your milk supply and you're working on cutting down, that's when we would want to use peppermint. And start really slowly again, because for some, the effect is mild and gentle, while others, they may see a dramatic drop in their milk supply with peppermint. So use this, and remember, it's everybody's different. So you could do 1 to 2 drops on the breast and use it for that. And that can be really helpful. For belly butter, there's a recipe on your handout, and you can use 1/2 cup of the coconut oil, the one that's solid, the one that's unrefined, and you could use 1/4 cup of cocoa butter and 1/4 cup of shea butter. And you can get these all at your health food store or on Amazon, and then use sandalwood, patchouli, and lavender. And you can just mix it up, and this could be a really nice one to just apply and put over your belly, and very soothing. And it's nice because it doesn't have any of those chemicals or toxins or endocrine disruptors or yuckies on there. And that could be a great thing. So let's talk about baby care recipes. What can we use for our newborn baby? And again, quality matters, and you want to make sure that you're using really pure therapeutic grade oils with your newborn baby. But if they're having a sore bottom, we can make a spray for that. And for any kind of irritation or diaper rash, you could put a little bit of carrier oil and a drop of melaleuca, lavender, and Roman chamomile. And those would all work really well. Put that into your 4-ounce spray bottle, and you can just mist as needed, like maybe when you're doing a diaper change. You can make your own powder, bentonite clay. I don't know if you guys have ever tried bentonite clay, but that's a really amazing thing. You can get on Amazon or your health food store, and you can put a drop each of melaleuca and lavender and add that to your bentonite clay. And you can just shake it up or keep it in a jar and just kind of have it there to kind of sprinkle in as needed. And that could be a nice option. You can make a hand cleaning spray for you and just keep it there on the changing table to have. And you could do that with 5 drops each of melaleuca, lemon, and lavender. Put a little bit of witch hazel if you want. You can get that at the health food store on Amazon, and put that in a bottle, shake it up. And I buy my bottles in bulk, guys, from Amazon. It's a great way to save money, and then you can just make a lot of sprays. And I have a label maker, and I just put that on top so that I know which is which. And you could just do a cleanup spray just of lemon or melaleuca, and have that with water. And you can just do that to spray down different surfaces, the bathtub, the toys. Because again, guys, I did a video, it's on my health coaching page. If you just look at Dr. Laura Ritchie on Facebook, you'll find my health coaching page. And I was talking about all of the antibiotic soaps and hand sanitizers and things, and what that's doing to our microbiome, and how they have triclosan in it and all this stuff. So we want to avoid the chemicals and things with newborn babies, and it's nice to just make natural sprays to have on hand in your home that can work really, really well. And let's talk about oils for babies. So gentle oils for your newborn babies. One, of course, lavender. Lavender's our go-to for a lot of things. It's just such a great oil, guys, to have on hand. And this can really help with emotional upset, with soothing skin irritation. If your baby's having trouble sleeping, if they're colic, if they're having aches, you could do this. In a 10 ml roller bottle, you could start with 1 drop of lavender and just fill the rest with fractionated coconut oil and roll it on their bottom of their feet, roll it on their spine, and that could be great. 1 drop's gonna go a long ways, guys. It's gonna last a really, really long time with all of this. And with babies, 1 drop per 2 teaspoons of carrier oil that you want to have on hand. And I like just to make the rollers because they're quick, they're simple, and you just have them on hand, and they're easy to throw in the diaper bag and just roll and apply when needed. It's really, really convenient, and it makes it nice to have. Oh, so Linda was asking, how do you go about sharing this with other people? Yeah, so Linda, reach out to me, send me a private message, and I can give you more information about how to share this class with people for sure. And you could always invite people to the group too, and they can watch and get the information from here as well too. But that's a great, great question. And I will, yeah, reach out to me and we'll troubleshoot that together. It's not a problem. Melaleuca is another great oil that you can use for your little ones. And this is really, really great for immune support, for skin health as well, to just have that on hand. If they're starting to get a little runny nose or a little bit of a cough or something, make them a roller of Melaleuca and have that on hand as well. Could be really, really good. Roman chamomile. Guys, I'm so excited that Roman chamomile is coming back December 1st. That's a really great one for emotional upset, skin soothing, for teeth. You know, when they're teething, you could even make a roller with some lavender and some Roman chamomile. Even white fir works really well for that. You can just apply it, roll it to their jawline, and have that there for when they're teething and they need a little bit of support with that. That could be really helpful. For colicky babies, a little bit of fennel to the belly button, kind of around that area with your carrier oil. You can make a little roller, or lavender to the bottom of the feet. doTERRA has a whole touch line of pre-diluted rollers in a lot of these oils. So if you wanted, you could just get those and purchase those and have them and they're ready to go, or you can make your own. That's what we did before those came out, and it's really simple and easy to have. For cord stump care, a little bit of lavender or myrrh diluted can work really well. For diaper irritation, you could do the spray that we talked about or the dry powder that we talked about and just use those to have on hand to support them. For digestive support, a little bit of fennel or ginger around the belly button could work really well. Again, you want to heavily dilute these with your newborn babies. For dry skin, you could do lavender, and that works really well in a carrier oil. This recommends olive oil. You could also try coconut oil as well for that. Any kind of natural oil would be really helpful. For ear support, Melaleuca, basil, and lavender behind the ears. So again, we never want to put essential oils into the ears, but we can go around and you can go behind. So you could make that roller and just apply it right around the ears as needed for that. And immune support, basil, frankincense, or Melaleuca to the feet. So you guys are seeing a pattern here. Several of the oils can help for different things. And again, it's just trying one, seeing how that works for you, seeing how that works with your baby. All of that's really, really helpful. And then for little teeth, for teething, lavender and Roman chamomile along the jawline in that roller diluted can work really, really well. And respiratory support, you could do lemon to the chest or the bottom of your feet to help with that. So again, we never want to put essential oils in the ear canals, in the eyes, or any of those mucous membranes. If there's irritation when you're using one of the oils, you want to get your carrier oil, your fractionated coconut oil, and use that. Dilute even more if you ever get a skin irritation. You don't want to use water because water and oil don't mix, and that could actually make the irritation a little bit worse with that. And just all good things to kind of keep in mind. Some of the oils are photosensitive and they could increase sun sensitivity a little bit. And these are our citrus oils. So bergamot, lemon, wild orange, things like that. And you just want to be kind of aware. Maybe don't put that on your skin and then go into direct sunlight and sit out there because it may make you more prone to burn. So just be cautious with that with your children. If you were using lemon for something and maybe putting it on the bottom of the feet instead of any area that exposed to sun. But all of that is just different little safety tips and tricks and things to help and support you with this. And yeah, so that's our class. That's kind of the main things that we're going to talk about in our pregnancy, birth, and babies class. And again, definitely check out this book. Such a good book, guys. And then the Essential Life book as well has a lot of handy dandy tips and tricks in there, a whole section on all of this. And we're just kind of skimming the surface with everything. I wanted to talk to you guys too about the holiday gifts that are going on. These are going on until they're gone. So there are some really nice things in here. Actually I have some up here on my table. I'll just grab them and show you guys. Oops, I'm dropping stuff. I got the Passion lotion, which is really nice. Passion's one of my favorite emotional support oils, and it came out in a lotion. So I got that as well. And I also did the rose. Oh gosh, guys, I love the rose lotion. Rose is an essential oil that you actually cannot buy. I think retail value rose would be around $400 because it takes so many petals to make a bottle of pure rose. So if you can't buy the oil, you can get the lotion. And this is nice to have on hand to support you. It's the highest vibrational lotion. It's the lotion emotionally for unconditional love. So I like to put it on my heart in times when I need a little bit of support. So that's kind of a nice one too that's in the holiday guide. You can get a cute ornament that you can apply your essential oils right to, and it makes your Christmas tree smell really, really nice. So these were some of the things that I got. But there's a whole kit. You can check them out when you are in your back office, and lots of goodies. A lot of these things sell out really, really quickly, so you may check. And my absolute favorite one is Holiday Joy. I love, love, love this oil. This oil really is, it's Christmas in a bottle. It just smells so amazing. We diffuse this from Thanksgiving to New Year's all year long. It's one of my favorites. I'll read to you guys what's in this because it smells so good. So there is Siberian fir, wild orange, clove, cinnamon, cassia, Douglas fir, nutmeg, and vanilla. So you can kind of imagine this is one of our favorites. So Holiday Joy is really, really nice. I would definitely recommend getting that. And I don't know, guys, there is emotional support with your oils. We did a class all on essential oils for mood management and emotional support. And it's just really nice to kind of have that on hand. And you can diffuse it when you're in big groups of family, because sometimes when we get family all together, it could be a little bit stressful. And we can have that and diffuse it, and it's just really nice to kind of calm everybody down. Okay, so Julie asked, how often should you re-scent the ornament? Oh, that's a good question, Julie. I think you could do it as many times as you like. I think if you're liking the scent and it's working well, sometimes they last on here for quite a while, for maybe a few hours, and I would just kind of check and see. I put it here on my desk because we haven't put our tree up just yet, but I would you can maybe even do it once or twice a day, and you could kind of see how that works and how that's working for you. If you like the smell, do it more. We just keep it in our diffuser a lot. Holiday Joy, it's one of my absolute favorites. It really does smell like Christmas in a bottle, which is really nice. And then let's talk about the BOGOs, guys, because this is going on just today. It ends tonight at midnight Mountain Standard Time. And the BOGO is you buy one cypress and then you get a lemongrass free with this. So wholesale, this is $15.50, and retail it's $20.67. And these are two great oils for so many things, for circulation, for lymphatic support. You can use both of these oils, are okay to be used topically. The lemongrass you want to dilute a little bit when you're using it. You can use it internally or aromatically. And as you guys remember, we talked about these oils, both of these oils, in this class for urinary support during pregnancy, but also in the pain class that we just did 2 weeks ago. Lemongrass internally can actually help to support lowering your cholesterol levels. So you can put that in a veggie cap and take that internally. It's very supportive of the thyroid. It can help with digestive issues too, so very supportive. You can put it in a capsule and take that. My favorite way to use this is for ligament and tendon support. So if you're having Charlie horses, if you're having stiffness, inflammation, muscle and joint aches, poor circulation, this is your oil. This can be really, really helpful. I love to use it with my Deep Blue Rub for any kind of like sports injuries or things like that. It's also amazing to use in your cooking. You can make a really great Thai soup and put a little bit of lemongrass essential oil in there. Emotionally, this is the oil of cleansing. It can help to transform holding on to the past. So if you're feeling kind of stuck there, if you're hoarding things, this could be a really great oil to bring clarity, to bring cleansing, and letting go of past baggage. And this is kind of a funny story. One of my friends, she was with her mother-in-law and the lemongrass spilled like all over her couch. And the nice thing about essential oils is they don't stain, but it was a really, really strong smell. Very, very strong smell. And they were trying to get it out and it smelled like lemongrass for quite some time. And then she went through this whole purging thing. I guess she was a teacher and she held on to a lot of things and was organized, but just had a lot of stuff. And she went through several days of getting rid of stuff and letting stuff go and donating a ton of stuff. And it was just funny because she was thinking, I wonder what the emotional component of lemongrass is. And it was letting go of stuff and cleansing. And I just thought that was hilarious. So again, the emotional components of the oils, it's very, very interesting to use with this. So that's your lemongrass. And then let's talk about cypress. So cypress really helps everything move. It's the oil of flow. It's beneficial to help if you've got a child with bedwetting issues, or if you need a little bit of support for urinary leakage, this could be a really nice one to have on hand. For aches, for bruises, for hemorrhoids, for muscle spasms, for heavy periods, all of this could be really, really helpful. Cypress could be very, very beneficial. It's calming yet energizing, and this can even work for swelling in the legs. Cypress, it's one that you're going to have to use for a little while before you notice some, especially with swelling in the legs. You're going to have to use this for a while to help with that. But it's really about flow. Emotionally, it's the oil of motion and flow with this. It can help a person feeling fear or feeling stuck or tense, and this can promote feelings of flexibility and trust and just flowing with life. So this is a nice one to have on hand. Again, these BOGOs, they're awesome. They only do them a couple times a year. So tonight's BOGO, it's lemongrass. Well, if you buy cypress, you get lemongrass for free. So you get the two together, which is kind of a really nice deal. And BOGOs are a great time to stock up on oils in your home, or also get oils for people as Christmas presents. They make great Christmas presents or stocking stuffers or things to have on hand. And I love doing that instead of candy or like other things. This would be a great way to support somebody's health with everything going on there. A little bit about upcoming events. I am teaching a virtual healthy holiday cooking class, and it's going to be on December 3rd. And from 10 a.m. to noon, but it's going to be very similar to this in a private Facebook group, just like this one. My brother-in-law is the tech guy, and it's going to be much more tech savvy than just me on my phone here. We'll be in my kitchen. We'll have lots of webcams and different views of things, and you'll get to see everything that we make. And yes, of course, we cook with essential oils because that's how we kick sugar to the curb, and we flavor things with essential oils instead. So I will post a link to this below too in the group. If you're interested in joining us, the replay will be up for 2 weeks, just like all of the classes in our group here, and you can come and check it out and cook with us. It's going to be lots of fun. Our next class is going to be on December 5th, and that will be our next virtual essential oils class, and it will be on Christmas essentials. So it's going to be lots of fun. We're going to be talking about how to use your essential oils during this Christmas season and gift ideas for people using your essential oils. We'll make stuff. We'll make a couple do-it-yourself recipes and things, and it's going to be lots and lots of fun. So you'll want to make sure to join us. This replay will be up until December 4th, and then it'll come down December 4th at 2 p.m. Central Standard Time to make room for our next class. So you can watch it as many times as you want until then. And yeah, if you guys are new to essential oils, if you don't have somebody who is mentoring you and supporting you and helping you along this journey, because it really is a life and wellness journey and a lifestyle change with this. And it can be a little bit overwhelming coming to essential oils in the beginning. It's a little bit like learning a new language. I would love to be the person to mentor and support you. I have a private Facebook group for everybody on my team, and I do Facebook Live videos very similar to this. The people on my team have access to these videos anytime. It's kind of an archive that they can look up and use this as a resource, and I would love to just help and support you. So please reach out to me. My information's on the bottom of your handout, or you can comment below, or you can send me a private message, and I would love to be able to help you. If you're not currently using essential oils with anybody, if you've never tried essential oils, reach out to me and let me know. I'd be happy for those of you guys in the US to pop a sample into the mail for you so that you can try them out and have them. But it's my passion to educate and support people and give people other options for natural remedies to support their health and healing, because they've just been such a gift for me. I don't think essential oils are the magic bullet, but I think they're a piece of the puzzle in our health, in our healing, and just kind of bringing everything together. So I would love to be that person to help you. If you're interested about learning more about the BOGOs or how to do that, reach out to me. I go to bed early, guys. This is winter time. This is adrenal healing time. So I am usually in bed by 10 p.m. But if you want to reach out to me before 9 p.m., I can help you with that. But yeah, I just love to teach. I love our community here. I think our group is so much fun. I hope this was really helpful for you guys. If you have any questions, comment below. But thank you so much for joining in, tuning in, and being part of our community here. And I will catch you guys on the next class. See you later. Bye.